Now to health matters. Nigerians are being advised to cut down on carbohydrates and sugar. This was said at the inauguration of a diabetic screening and treatment center in Lagos. We have details in this report.
Nearly half of Nigerians consume excessive processed carbohydrates. With an imbalanced diet, many of its citizens are prone to obesity, heart disease, and even diabetes. This is a country with over 211 million citizens, but yet its foods seem to be minimal or lack many choices. One of the many ailments that affect people's lifestyle and diet is said to be diabetes. Going into the streets of Lagos, some Nigerians shared a bad experience about the disease, while many had no idea about it.
It's another form of disease that affects human being. The diabetes doesn't mean the death certificate or death warrant. It's a source of have a mind of maintaining it.
My dad have, and it's caused by drink also. When man take a lot of beer, anybody that take a lot of drink, that you drink a lot, maybe beer, sugary things, at a point of time, even though diabetes can even catch a small baby, if intake of too much sugar.
It is much sugar that causes diabetes, so we should just minimize our sugar level.
On this varying perception, I visited a physician who broke down the actual cause of diabetes and how to prevent it.
We found out that some of the risk factors are sedentary lifestyle, lack of exercise, obesity, even hypertension. And lots of people with increasing age come down with high blood pressure. And so what we do is we counsel them to do more exercise, moderate exercise 3 times a week, at least 30 minutes. It could be walking. Even those that can't walk, we encourage them to do house chores. But those that are fitter can do more vigorous exercise. Not like a diabetic cannot eat carbohydrates at all, but we tell them to eat the complex carbohydrates as opposed to the refined carbohydrates. The complex carbohydrates are like if you want to eat things like sweet potato, you understand, or if you want to eat yam, it should be small. The portion sizes will be given to them, but pounded yam is not advisable. So you understand, it's more refined than yam itself, slices of yam. You know.
To educate more persons on diabetes, stakeholders from a foundation in Lagos State commissioned a diabetes screening and treatment center to encourage consultation and ensure persons know their health status.
This being the biggest local government in Lagos State, it starts from Iyano Ekpaja to Lasu. So you will appreciate the need for us to have an edifice of this nature. People are aware of these facilities. It has boosted the level of patient coming in, and we hope that more will be done for awareness, advocacy.
It is not just enough to do awareness. There should be a place where patients of diabetes will be mentored and monitored. It is true that we eat a lot of carbohydrates in this part of the world, and our task as lions and those who are doctors is to raise the awareness level so that people can balance what they eat.
A representative of Governor Babajide Sanwo-Olu was also in attendance to inaugurate this project.
One of Mr. Governor's priorities for the health sector in his tenure, infrastructural development for our hospitals, to make them much more responsive to the needs of the populace, and this will definitely help in that regard.
This project is surely another way to ensure that persons are well educated on the causes and prevention. While carbohydrates might be the major source of food in Nigeria, vegetables and fruits are well advised to avoid ailments like this. Inioluwa Popola, TVC News.